Welcome to NeuroNoodle's Neurofeedback and Neuropsychology podcast featuring tech legend Jay Gunkelman. He is the man who has read over 500,000 brain scans. Our goal is to provide information and promote options for better mental health. The NeuroNoodle podcast is supported by listeners and viewers just like you. And a special thanks to our gold and silver supporters. Earn up to 16 CEU hours by attending Applied Neuroscience's NeuroGuide workshop December 10th and 11th in Madeira Beach, Florida. It's led by none other than Dr. Robert Thatcher himself. There are two ways you can attend, online or in person, with the link appliedneuroscience.com/attend-ng-workshops. And if you sign up now, you can join Dr. Robert Thatcher at his house for a pre-course get-together December 9th. It's going to be a blast. What a better way to enjoy winter by being in Madeira Beach, Florida, and earning up to 16 CEU hours. Sign up now at appliedneuroscience.com/attend-ng-workshops. Mindmedia.com. Get the latest EEG and neurofeedback technology from mindmedia.com. Their semi-dry sensor cap is a wonder to see, and their EEG amplifiers have been trusted in the field for decades. Their neurofeedback and qeeg courses will get you up to speed in no time. Visit mindmedia.com now. Alex Nee, CEO of Divergence Neuro. Welcome back to the show, my friend.
Thank you very much, Pete. Thanks for having me back again. And thank you, Jay.
What has happened since the last time you've been on? I go to your site and I see new devices, affordable devices. What's going on?
Well, lots really. So you've hit the nail on the head as a starter. We've added a couple of really affordable new devices onto our platform, which means you can purchase them at an affordable price. So starting with this one called the BrainBit band. So that's a 4-channel dry wireless EEG band. This one has a really appealing kind of low profile form factor. So it looks like one of these 1980s old tennis star sweatbands. So you can just wear it kind of like this. I won't because I got my headphones on, but it covers 4 sites. You've got T3, T4 on the temporal side, and then you've got O1, O2 on the occipital side. So this is a really rather a great entry level device if you want to do, posterior alpha, tracking your posterior dominant rhythm, things related to sort of introspection or externality of focus versus, emotional balances on T3, T4. So these ones are fairly comfortable sensors. You can squeeze them. They're compressible, fully dry, fully wireless. Plug and play. It's completely Bluetooth, so very, very easy to use anywhere with your device and our Divergence app, obviously. And then we've got a more.
Wait, hold on, Alex. I don't mean to step on you. That thing's what, $500?
It's $500, Pete. Yeah, you got it. So
That's
it's pretty affordable as far as a device that delivers a near clinical grade quality EEG. Now we've worked with BrainBit for about half a year now, since really in May timeframe when we received our first prototype. And since then, we've picked apart the data that's been recorded on that device and many other devices, and we've compared that in terms of signal quality with some of the high-end clinical devices, and we're happy to report that it does look very similar to a very clinically validated device in terms of amplitude, in terms of digital signal quality and characteristics than most of the devices that we've seen out there. So that's the first bit of good news.
I have to roll the clock back just a little bit. The rule of thumb, and rules of thumb, what you should do is cut the thumb off, of course. But the rule of thumb used to be that for an amp, you'd expect about $1,000 a channel. And it sounds to me like you've got a 4-channel for $500, which is way below the expected $4,000 that you'd kind of the rule of thumb. So I'm glad I'm missing a thumb. You know, it, of course I do have my thumb. I cut 4 fingers off. I've got
Oh,
all my
Jay.
thumbs. So uh, it's astounding to see the price come down and the quality remains solid. And that it's easy to make a cheap bad amp, but people are making inexpensive, not cheap, but inexpensive, but good quality amps at this point. So I'm very pleased.
To Jay's point, I think it's truly we live in a brave new age where I've certainly heard of that, $1,000 per channel rule of thumb, and this really kind of underpinned much of the classical clinical EEG era, where that's still applicable, in sort of the high-end devices with rugged amplifiers and wires and clinical devices. But on the flip side of that, I'm happy to summarize what I've seen in the last five years or so, particularly ever since the open BCI architecture, is really adopted by a lot of the hobbyists and then more serious researchers, ultimately clinicians that are treating people with things like anxiety, ADHD, trauma, depression, where form factor has become as important, if not more, as the pure sort of accuracy on the highest of high end. But we're talking about how pandemic has completely transformed the way that we see healthcare, including mental health care, obviously. I was just at this conference in Las Vegas till yesterday called HLTH, or Health Conf, and everyone's talking about outpatient care. Everyone's talking about at home remote care, and I think we've come to the point where we can't dodge the question. For any system that delivers any kind of care, how is that going to be applicable when a patient does not have the physical capacity to come into a clinic and get wired up and undergo the sort of more traditional rigorous kind of EEG outfitting. So I think that's where you see that mode really being broken or transformed, where we're seeing amplifiers that are really size of not much bigger than your thumb plus battery that is able to amplify up to 500 data points per second at a very specific digital resolution that rivals most of clinical devices. And we're seeing EEG really, on the other hand, to prove that point. And then we've got fully dry wireless sensors mounted. So this is the other one. It's called the Flax. So this one is a 4-channel device as well. But unlike the band, the difference between the Flax is that you can attach 4 channels anywhere on a pre-printed 1020 cap with locations marked on them. So what this allows you to do is obviously, as the name suggests, flexibly define any protocol in terms of measurement or feedback, and attach the leads on the other end, like so, where those channels are, and use them flexibly in the divergence system. So you can create so here I've got my favorite, midline. So it's FZ, CZ, PZ, and OZ. So I've got all 4 channels mounted in the midline. Then I can just put it on to my head, within about a minute, and then have a stream EEG pretty flexibly with no gel. It's quite a transformation from where we came from. I think in terms of mobile EEG, quality mobile EEG. And this unit retails for $750, and it comes in a convenient little box that looks like this. And we've already started to have a lot of our providers onboarding this unit on our platform. Especially folks that really love midlines, and which is something unfortunately missing on a lot of these sort of mobile solutions, for one reason or another. So this is a quite a neat unit to kind of watch. Yeah.
And the midline has such good information locations, anterior cingulate, cognitive flexibility, obsessive compulsive, amotivation, addiction. About a third of the addiction is driven by the anterior cingulate. The vertex, where somatosensory, insomnia with beta spindles at CZ, PZ, your default mode network. And the default mode network can be flipped off by the salience network. So you've got all that at the simple 3 electrodes at the midline. And you toss in an OZ on top of that, and some of the people who do occipital alpha theta as opposed to parietal alpha theta, they've got it all in an inexpensive dry sensor system. I used to have to stick 21 needles in kids' heads, a centimeter long needle stuck to the hilt, so, I, it was a dry sensor until you stuck it in, and then it was definitely wet. And, the advances are tremendous. We don't have to sedate unconscious a kid in order to get them to cooperate for a study. No kid's going to sit there and have 21 needles stuck in their head without wanting to leave the room, So the good old days weren't the good old days. These are the good new days now. And the future is so bright, I have to cover one eye, So it's astounding how far things have come and how far they still are going to go. And the future is extremely bright, and in part because of individuals like yourself who spun off of a project that was looking at EEG, trying to predict seizures and epilepsy with AI and artificial intelligence kind of stuff, looking at EEG, and you spun off into the neurofeedback world. We will harvest all of the bright people we can from traditional and research application areas and apply them in the neurofeedback world. It's interesting to see the high end research people kind of streaming into the neurofeedback world now with interest in the clinical applications. The computational neuroscience people have been kind of avoiding clinical, focusing on their mathematics basically for 20 plus years. And they've gotten really, really, really good at it. Their techniques are fabulous. The software is impeccable, and shareware, which matches up nicely with the low cost approach for devices. So, the future is extremely bright, and it's companies like Divergence Neuro that are kind of the headlamp for the field, showing us where we're headed.
Alex, you have that cool 80s headband, and then you have that black unit. We got moms and dads that watch new techs. Okay. What would be the difference? I'm assuming that you would send it out, or they would buy it and they would use it at home, tie into your service with the phone and train. What is the difference between the two?
Yes, of course, and that's a great question, P. So I think the main difference is simplicity versus capability and extended number of features, right? So if you want to train your alpha up, in the posterior, with classic Joe Kamiya, alpha down protocols, whether you're training external focus or spaciousness and spatial awareness using the alpha and the rare, I think this is an excellent device to start off with, where you don't have to fuss over placement. You simply put it on. I'm going to demonstrate it. I'm just going to, excuse me for 1 second. I'm going to detach my headphones here so you can put it on like so, and voila. there you go. And the reference is in the front, and so is the ground. So you can see on the opposite side, there's some metal here. That's the ground in the middle, and these are the references. So everything is centrally referenced their forehead. So there's a downside to that. If you have a lot of eye blinking or muscle movement on the forehead, you could potentially risk some contamination there. But because the frequency bands are so far apart, even with some global impact there that ripples out from the muscle movement, you're still going to be able to get pretty clean shot of alpha, especially in O1, O2. So that's what we see a lot is since this device has been added onto our platform, which is really since the last ISNR. I remember announcing this on ISNR, August 1st this year. We've sold about probably close to 50 devices to our end user group. And people reported that they love this device because it's put on and go, and there's not a whole lot of hassle that you have to contend with in terms of placement. So it's a fairly user-friendly device, especially for beginner population that know what they want to work with, which are simpler protocols. And you can also work with balancing protocols. My friend Rebecca has been training sort of lateral balancing, squashing the low frequency ranges and delta theta with T3 and T4. And she's been really kind of excited about waking her brain up again without getting too much specifics. But just on T3, T4, there's been some concerted progress achieved there over the last 4 or 5 weeks that I've seen. So it's simple. It's quite poignant and it's elegant. You can take it in your backpack pretty much anywhere you go. And the battery is very minimalistic. It looks like this, and then you just slot it in, and it keeps for about 12 hours of continuous operation, which is remarkable in of itself. And you can even use this to do sleep study as well. Kind of turning around to the more advanced model, of course, we talked a little bit about the flexibility, and I think the other thing that's worth noting is the ground and reference leads are earlobe attached. So they're A9, A10, I believe. Correct me if I'm wrong, Jay. They're earlobe attached. So there's very minimal amplitude disturbances or common mode noise that comes out of the mastoid. So you tend to get much cleaner signal, in terms of, again, with these great compressible gold-plated sensors that can get through quite a bit of hair. And with these advanced models, our clinical population tends to really have a sweet spot on them because a lot of our folks are fairly advanced neurotherapists. They want to create protocols that are, very potent for 4 or 5 channel protocols. They can cover the midline. They can cover part of the central executive network, salience network, as well as default mode network, all at once using 4 channels, which isn't so much of an easy requirement for most of the devices out there, believe it or not, to achieve this kind of coverage while having the flexibility and all the while being under $1,000. That didn't seem like a very easy requirement to me. So I'm glad that with the addition of the Flex device, those requirements can be addressed. So I'm happy to sort of see the clinical population, the therapists embracing this unit here.
Given your company's orientation, the end user isn't just hung out to dry either. They're tied in through your Dive app back to the home office's link to the therapists, and it allows for monitoring. You've got the ability to query your clients. How was your sleep last night? Did you eat a good breakfast? I mean, you can actually ask meaningful clinical questions that are little quick texts back and forth, so you can stay in touch with your client and interact. Feedback from your client is important in order to know kind of how was the effect of the session that we ran yesterday with a different protocol. How did your day go?
That's 100% correct, Jay. So I'm just deciding to share my screen a little bit here. So we
Shoot,
revamped
and I
our.
thought I just made it up,
It's as if we're on the same frequency sometimes. I don't know what to tell you. So, right here, you've got two sections of questionnaires, and this is a bit of an advanced view to what we've improved recently. We've pulled all the questionnaire responses here, so you can actually look at the intake questionnaires when they're done and sort of their answer. So these are obviously not real patient data because I'm using my demo account here. And then pretty soon we're going to have aggregate graphs in terms of tracking the progression of recurrent questionnaires using standard scoring such as GAD-7, PHQ-9, and others. So you can see more graphic representation. But for now, as you said, all the intake data for intake and recurrent questionnaires are pulled up here, tucked under the specific client's overview. So you can have all that information, in one view. And then right up here is a client dashboard, which shows me, how often these clients have been training and this particular client, what their training averages have been day to day, week to week, and so forth and so on. And I can also look at as their provider, I can look at their percentage of reinforcement here, active duration on average, and how did their training go on a particular day, all in its gory detail. And right up here, I have some sections indicating the training progress on a week over week basis, how fast they ramped up, and what their sessions have been and recent activities have been. So I have a single dashboard that basically allows me to pull a very quick bird's eye view. And then if I want to drill down, of course, I can do so, by clicking a button, and that gets me into their last session that they've commenced on the platform. So, again, here's the raw EEG. I think this part, you've seen before, Jay. Here's the raw EEG collected on one of the BrainBit devices. And here's the computed metrics, in this case, alpha, between 01 and 02, with a threshold of 60% for, I think this one is external focus because we're inhibiting alpha on the back. So yeah. So data is something that we take very seriously. We're really trying to create a platform that is first and foremost device agnostic. I think you see this in our philosophy in incorporating different kind of devices. We started last year with Neurosity Crown, which is $1,000, 8-channel device, excellent device. Great if you have the budget because it does cover 8 channels and the signal is second to none. And then we added more low profile sort of entry level devices like these ones for our, more simpler users that are training 1 or 2 things on our platform that don't perhaps need an 8-channel device. Seems like a bit of an overkill. And then we've added this very flexible device to accommodate for advanced clinicians that want to place their channels flexibly in accordance to their own needs. So, but I'm also excited about something else at the same time. I think that one of the things that we've talked about since last year was, this perspective that we're this platform that can accommodate for most devices. But what we primarily focus on till today is the aspect of neurofeedback training. So obviously this begs the question, what happens to the other side of measurement and, of assessment, right? So, Jay would tell all of us in his teaching consistently that, look, there's a whole standard and best practices and database and people that came before us, so that we're lucky enough to pick up the benefit of this work to have these qeeg databases that provides us with empirical evidence of, how the neural networks are behaving and how that leads to express symptomologies of A, B, and C. So we have none of that on our platform today, but that is about to change. So the other really cool piece of news that I'd love to share with the two of you first is that the Divergence platform team is working on, for its first time in its existence, an assessment methodology that could leverage 4 channels strategically and using clinical relevant symptomology databases to come up with a functional assessment that incorporates the biosocial cycle model which uses limited channels of EEG data to basically add an empirical structure that will allow, genuinely biopsychosocially oriented folks to treat their patients with a guidance that is created in a very functional and effective way. So we're working on this assessment model. The working title of this model would be Q Pro. So you heard it here first at the NeuroNoodle show. We're working on Q Pro to be slotted for release mid-January in a proof of concept capacity for all the users on Divergence platform. And Q Pro will be best carried out with a flex device, which we have the freedom to place channels in different parts. So that's something that I'm really excited to announce. And then we've hired an amazing chief clinical officer just recently. That's a bit of mystery. I will share that in the time to come. But he's someone that has 35 years of clinical experience and 20 years of neuro experience. Comes from the West Coast. And he's very excited to guide the Q Pro development with the Divergence team using his knowledge and skill set. So all those excitements are going to be unraveled in the very near future if you stay close to our blogs and our development news on the Divergence website. But yes, it's a very exciting time indeed.
You heard it here first on the NeuroNoodle podcast. Alex, somebody buys the product. We can go from the 80s headband to the more advanced. They get it, they put it on. Can you just walk through what the process is, like an unboxing? Like they open it up, what's the next step? Like who's controlling the thresholds if they're going to train? How does all that go down?
Certainly, yeah, I can actually walk you through this with the real software. So
Earn up to 16 CEU hours by attending Applied Neuroscience's NeuroGuide workshop December 10th and 11th in Madeira Beach, Florida. It's led by none other than Dr. Robert Thatcher himself. There are two ways you can attend, online or in person, with the link appliedneuroscience.com/attend-ng-workshops. And if you sign up now, you can join Dr. Robert Thatcher at his house for a pre-course get-together December 9th. It's going to be a blast. What a better way to enjoy winter by being in Madeira Beach, Florida, and earning up to 16 CEU hours. Sign up now at appliedneuroscience.com/attend-ng-workshops.
one of the first things that our clinicians would do when they get the gear is that they will add the gear into their inventory. So you can simply do so by navigating from your main web app. You choose devices and you can just click on add new device. And then right from there, you can choose one of the 3 devices that we support. Again, I'm going to use this for an example because I really love the Flex. So on the back of every device, there's a little tiny serial code. I don't know if you can see it from a camera here. So you add that 6-digit code in there and it's easy as that. I'm just gonna do that. 8. Okay, so I've just added this BrainBit device under my management. So from there, this is really one of the ways that we can manage devices as a provider. So this presumes that the provider buys the device and then adds it to a client account and manages it on behalf of the client. So the next thing you just simply want to do is you assign that device to one of your clients who's under your management. So you simply go to device clients and you pick your client. And in this case, I'm picking, again, my demo client here called Divergence Test. And then I'm just going to click assign and voila. So that client, when they log in, they're going to see the device that you assigned to them under their Dive app here. So and all they have to do is then, after firing up their Dive app, they're going to attempt to connect to that device once that device is powered on and within the vicinity of the mobile app here. So I'm just going to log in, and I'm going to, of course, pair. You can see that pair was my Flex device here. So once I'm done, it should say device connected and give me a battery percentage. I was using this quite a bit yesterday and the day before, so it's still at 79%. You can see it's pretty good. So then what's going to need to happen is I'm going to need to find a protocol that that basically is created for that device. So I'm going to actually create one from scratch, just so you know the process here. So as I mentioned earlier, the Flex device allows you to create many different protocols leveraging different channels flexibly. So really, it depends on what your favorite configuration is. So let's call this Jay's midline. In order to differentiate, we need to give a protocol a unique name. So we're creating this as a special protocol, because Jay's very special to me anyway, and to the rest of us, I'm sure. Midline specific. A little bit about the protocol. Let's run it for 3 minutes. Why don't we? There's a 1 minute baseline. And then here's where things get interesting. As soon as you select bring bit flags, you're then presented with a 21 channel montage. So again, out of the 21 channel, you're allowed to choose any 4. Remember, the capacity for number of channels with Flex device is 4. So as we said, we wanted to take all midline for the 4 in this protocol. So we're starting with FZ, and we're going to work our way back to CZ, PZ, and ultimately OZ. So now these are our 4 channels, and that's what's going to be associated with this protocol every time. Now, just type in something here. So one thing to point out is that when you create a protocol, just because we have to select the feedback type. So between separate and combined feedback, which we'll go into, let's do combined just to humor ourselves, just to keep it simple. So here you can actually hear the feedback. So if I share my sound through the system, which I'm going to right now, you can hear what kind of feedback you want to choose to deliver to your customer. That's a little strong. How about something gentle? We can create our first event here. So out of 4 possible positions, we can choose to say we want to use PZ here, and we want to train. Let's do a classic alpha down. Why don't we? We can inhibit, tighten up the band a little bit between 9 and 11. Actually, I want to train high alpha, so I'm going to go 10 to 12, and I want to start with 60% here. And there's our event. We want to inhibit that alpha, particularly at PZ, which is really a classic joking. All right, so let's say we can kind of check out different feedback here again till we're happy with it. Share the sound again. So this is a static noise. We can also use video feedback. That is YouTube feedback as an option. So there are many different options that we can use as feedback. So this is another flexibility of the platforms that allows you to create feedback almost willy-nilly. So you can see I've got a ton of audio feedback that I've uploaded as MP3s, and I've also got video feedbacks that are basically YouTube videos that I've created. And to create a feedback is simply go to feedback, and you can insert either a MP3 here and make it available later, or you can create a video feedback by inserting a YouTube URL, either of which could allow the client to see that precise feedback you want. when you choose the feedback here. And that's how the feedback is sourced. So for now, we can keep it to be something simple, maybe like a light rain sound. Something nice and soothing. Not bad. Okay. And create other events as well. You can say, let's inhibit gamma in the front, because we don't want somebody to be too excited doing this protocol. It's just tighten the gamma band to be 30 to 40, and then again, we're going to go with 60%. So you've got inhibit gamma, inhibit alpha, front and back. This is really kind of a, did I do that right, Jay? I think that's a classic one.
In fact, there's so many different ways to do things. I mean, training alpha up is an approach for old-fashioned Kamiya work, but obviously the PTSD people have identified alpha suppression as a one of the ways that you can end up helping with PTSD. So you're suppressed at PZ for alpha, or OZ at alpha basically would end up being something that would be commonly done for a PTSD client. But
Amazing.
Training alpha up is different than training it down, but you have the flexibility of, depending upon what the purpose is. Somebody who has almost no alpha and needs to kind of chill out and relax and make more alpha, you have the alpha enhancement approach, and somebody that's got PTSD that ends up being to have the alpha suppressed. And actually following the alpha suppression training, there's a rebound, but they're learning control over their alpha power. And I think ultimately the suppression giving the control ends up being useful for the PTSD folks. But you've got flexibility. You can train whatever band, whatever location. At this point, 4 channels. It's my understanding that the same company is going to be producing one with more channels for you at some point. But the future is the future. And as I say, it's so bright I got to cover one eye.
Excellent. Thank you. Thanks for that. All right. So we're just about done here building this protocol. As you can see, folks, that took us about, less than 5 minutes to build, and in a very graphically intuitive user interface where everything's wired in. So what we've got to do next is let's make use of this protocol so that we can push it to one of our clients, in this case, my test client. So I'm going to save the protocol first, find it in the list, and then I'm going to make a run schedule based on that protocol called a session. So here's our protocol. So what we're going to go do next is we're going to go deploy that protocol by creating a session. Let's call it Jay's session. So again, find our client, and then in the session control tool, you can easily customize different aspects of this protocol pertinent to the specific run. So you can modify the thresholds on each event. You can modify overall protocol duration or baseline duration. You can even modify feedback type and particular feedback that you decide to use without changing the template protocol definition itself. This is why it's called customize. You can really customize that here fairly conveniently. So this allows therapists to easily reuse protocols that they've created without recreating it again and again and again, and once for every client. So once you've done that, you can choose your protocol recurrence here, or if you want to just try it out, you can just point and click on a calendar, number of days that this protocol will run. So let's do that since we're just trying this out. I select the 17th, 18th, and 19th of November being the run dates. So I can go ahead and say, create a session. And so when you get to here, the system actually allows you to combine, questionnaires, as Jay mentioned earlier, so that you can assess the user's subjective experience right after they've completed a neurofeedback protocol. So you can quickly help understand what's gone through their mind and how did that protocol go and what were their experience while doing the protocol. rather contemporaneously instead of having to send them an email or something else after, which they may or may not fill out. So this way, all the questions and protocol related assessments are staying in the same app, right? So right now I'm just going to drop a quiet mind assessment just to prove the point. So I'm going to hit them up with a one question assessment right after they've done the protocol, and that tells me how their experience has been. So everything was good. I'm going to turn this protocol on and then see how that looks when they do it. So after you create a protocol, the last thing to do here is you just want to turn the session on by activating. So we're going to find the session first. Here's our session, and then we're going to simply activate. And when I log in with my phone, I'm going to find this protocol in my client's protocol run list. So now the therapist part has been done. The rest is I, as the client, logging in. And if you can see my screen here, you should have Jay's protocol somewhere. Let me find that. Jay's session midline. Here we go. So if you look at it closely, my camera is not, there we go. There's the focus. You can see the J session midline that we just deployed. So we're going to go ahead and do it. So you're going to bear with me as I take off my headset and put on the cap and put the headset back on.
You got it.
Sorry about that. I hope you can still hear me. So what I'm going to do is to put on the headset like so. You just wrap the chin strap around your chin. Make sure your ears are poked out. And then you want to make sure the other thing is that the electrodes are making contact with your scalp. You just want to massage them a little bit. Just make sure they're all fixed in place and you can feel them. So then what you do is you take the clips, you put on your earlobe like so. So again, these things are fully dry. There's no saline, no gel to fuss around, and I'm about done right now. So my headset back on. Can you still hear me?
Yes.
Excellent. Okay. Well, we're good to go. So I'm going to again connect to my headset here by selecting the headset. And now it's attempting to connect to my Flex headset. It's taking a second, and now it's telling us it's connected. So you want to see this before you start doing a protocol, making sure the headset's good to go. And then we're going to choose J session, and it's going to prompt you how to connect the electrodes. If you haven't already done so, if you've already done so, you just force through these sets of instructions, and then you should end up looking somewhere around like this. And then we get started. We want to wait till the electrodes both turn green. That means your signal quality is good to go. So we use impedance matching provided by the BrainBit hardware in order to assess signal quality. So as I'm going through this, what I wanted to do is look at my own brainwave data, and I can do so by navigating to my client screen. And then in the client that I'm looking at, I have what's called a live waiting room. So when I click on join as a therapist, I can see if my client started to do their protocol. So I'm starting this protocol, and it's within the first minute baseline. So as soon as I stop talking, you'll see my EEG from the cam. Some amplitude noise, mainly because I'm wearing this giant headphone on top of what I suspect will be CZ and PZ. I'm going to make a small adjustment. That should give me better signal. So what you're seeing is my real-time EEG. I'm going to close my eyes now. Yeah, several of these channels will feed back stronger alpha components than others. And you can see the computed data on each advance. So first, the gamma suppression. And then secondly, the alpha suppression, because I'm paying a lot of attention externally. This part's not difficult. So the video will go brighter or dimmer based on how I'm meeting the criteria. So is the sound, louder or quieter. I don't know if you can hear the sound from the protocol. I'm not doing so well now because I'm distracted. So you can see the feedback taking place here. So, and here's the real brain waves. Because I'm talking, it's a little noisy in the back. I can try to adjust it. There we go. I think this might have been my OZ. I had it backwards. So you have to be fairly careful when you attach the leads, but this was OZ. As soon as I close my eyes, you can see what happens here. See that strong alpha components, and that's got to be PZ. So alpha would be the most prominent on OZ and then PZ, and then ripples outwards. So there you have it. That's my training protocol, and now I'm done. Not bad for the first time, 65%. This is, I know my brain fairly well. I've been doing this for a while. And the next thing I'm going to do is I'm going to fill out my experience on this. And all it contains is a single question: how quiet did you feel? So it's a sliding scale. I'm going to move it to, somewhere about a 2 because I didn't feel too quiet talking through it. Anyhow, and that's that. That was my client's experience. Now, the client's done here. What we can look at is what actually happened during that session. I'm going to detach my head cap, continue this part, and like that. No mask, no fuzz, no gel.
And now we have to wipe all that stuff out of your hair.
Hopefully. So I can play through the EEG here as raw EEG. You can see the quality is pretty decent, except for one channel is a little off, but this is 100 microvolt range by default. So you can see the variation for the most part stays underneath 50 microvolts, which is fairly decent in terms of filtering amplification. You can see those alpha spindles there when I close my eyes. Fairly registered alpha. It's characteristic to my brain. Okay, so it stays fairly consistent except for the third channel throughout the recording. There's some disconnect when I was taking my headphones off. A little bit of muscle noise here. Typical after a 6-hour flight last night. And again, here's our calculated data. So this one again is gamma in the front. So I think this is really in the back, unfortunately, but because I have my wires crisscrossed, but you can see the computed, gamma amplitude here on average throughout the 3 minutes that I did my protocol. There's some spikes here and then start trending down as I, focus on internal calmness. And here's my alpha comparatively all over the place. There's some noises here, but you can see the computed data coming from these two events. So yeah, here you have it. In the future, we'll create a protocol that's just based on measurement with no feedback, so we can capture about 3 minute worth of data and really using some of the state-of-art ratio detection that looks at eyes open, eyes closed, alpha ratio, alpha recovery ratio, theta beta ratio, these critical ratios from different sites to understand how different parts of the brain are working together, and using that information, we can infer, brain health in terms of these sets of critical data. And we will be rolling these data into a report. I'll give you a preview on what is about to come. So we'll be rolling some of these data in a report like so, and then have, clinical remarkability ranges identified based on these data sets computed from these locations here. We'll have an assessment protocol which collects data, and then we'll run it through the analysis engine, and then we'll generate ratios and visualizations that looks more or less like this. And then you're going to be able to get a full out report based on these ratios as to in what ways your brain can be potentially clinically remarkable, and in what other ways they're not clinically remarkable. So, here are some of the ratios, just a sneak peek that we'll be computing. So very exciting times.
Now,
Thanks.
you buy the product. Is there a subscription, or you buy the app too? How does that work?
Yes, glad you asked. So that is one part I didn't cover. I apologize. So it is a straight up monthly subscription if you're a provider. You would start at, let's say, $100 a month. That would entitle you to 5 patients on our platform. And if you need more, you can always upgrade later without any kind of a long-term commitment.
Right.
You have 30 days to trial it out. That's on the software. And if it's not for you for whatever reason, you don't have any obligation to continue to pay us. So you have a 30-day free trial period to determine suitability of the platform to your practice.
Learning curve looks awesome. How about cleanup? Like, how do you disinfect?
So to disinfect is actually quite simple. So it depends on the device. If you have something like the cap, what I would do is simply unmount all the electronics like so. I'm just going to do it right in front of you so you see how fast it really is. So you're going to unclip the buttons from the sensors and then shake them out. So here are your sensors, all 4 of them. So what I would do typically is I would soak them in a Propofol dish face down, and then let them hang out to dry for about 10 minutes. That's how you disinfect the sensors themselves. Okay, so they're just metal gold-plated sensors, nothing too nuanced about them. You don't want to get gel stuck into these things because they could make the spring-loaded pins stuck.
Right.
You don't want that. That's a problem. But that being said, these things you can wipe them down with alcohol swabs or with alcohol napkins, right? And these caps, they're basically nylon caps. So what I would recommend is cold water hand wash and hang dry for about an hour. So there's almost nothing to them, you can see. And again, I know BrainBit ships these caps in 3 sizes by default: small, medium, and large, to fit different head sizes. So they're fairly easy to clean because everything's modular, right? So, and if follow my personal channel, you know that I MacGyver some of these with a baseball cap. I don't have it here. Oh, here it is. I can use my baseball cap to mount the same electronics underneath with pre-drilled holes on them. So that's just a personal preference. You can certainly do the same if you know where the holes are going to. So yeah, that's just something I enjoy doing on my own. But if you're looking at something like these, what I would do is take an alcohol swab to clean on the inside, and again, clean around the electrodes a little bit, and then just let it hand dry between uses. Simple as that. Yeah.
Newbie question: what if I just had a UV toaster oven and I put it in there? Would that do it?
Yeah, UV is so certainly a good idea for the sensors. I wouldn't probably subject the PCB part, which is the electronics part of it, in UV. I mean, not that I think it would necessarily have enough power to damage electronics. Just typically I would avoid it. for safety reasons, but otherwise that does pretty well too. So if you can toss the sensors like these, you can toss your cap into UV. It's quick. Always a desirable solution.
Jay, this is nifty stuff, man. The price is coming down. You can have a stable of caps. You can afford it, and the learning curve for the techs is pretty quick. So I don't know. It's looking pretty good.
Future's so bright, I gotta cover one eye.
Alex Nee, CEO, Divergence Neuro. What's the best way for us to learn more about you?
Well, I started writing a blog. I've been so busy, and that's a great question. I've been so busy working in the business, leading our team, in terms of product development and how to translate some of the stuff into working code, that I haven't actually taken a pause to start, writing some of the strategic direction stuff. So I haven't realized that I've recently started a blog. So if you go to divergenceneuro.com, you will see my first blog, and it's really starting from why we're doing the things that we're doing. So if you just go here, you will see that my first blog is actually a year in review in our 2022, and the first part talks about all the reasons why we have to invest more into technology when it comes to mental health, and all the factors that starts destabilizing, from pandemic to politics to health issues to healthcare general direction, and the people who really need help, and how that number is really growing. So I plan on continue writing this blog at about once a week, once every couple of weeks, to really communicate not only our progress and product roadmap, but really the development around mental health technology, and especially when it pertains to neuro. So this will be a thing that is somewhat ongoing, and also if you follow my LinkedIn at Alex DNI on LinkedIn, you'll see that more sort of just-in-time updates that I'm what I've been up to, what Divergence has been up to. I posted a few things about the conference we were at in Vegas. Here's for example, me demonstrating the latest devices with some of the Canadian healthcare innovation folks that went to Vegas over the last few days with us. And yeah, so awesome. LinkedIn is an excellent way to stay in touch with what I've been up to as well.
Oh, Alex Nee, CEO, Divergence Neuro. Thank you for coming on the show, my friend.
Thank you, as always, Pete. Thank you, Jay, for giving me the space to talk about our very exciting new developments at Divergence, and looking forward to being on the show again and catching up with everyone.
Oh, absolutely. You're always coming out with new stuff. Awesome show, Alex. Great job, man. The NeuroNoodle podcast is supported by listeners and viewers just like you. A special thanks to our gold and silver supporters. Earn up to 16 CEU hours by attending Applied Neuroscience's NeuroGuide workshop December 10th and 11th in Madeira Beach, Florida. It's led by none other than Dr. Robert Thatcher himself. There are 2 ways you can attend: online or in person, with the link appliedneuroscience.com/attend-ng-workshops. And if you sign up now, you can join Dr. Robert Thatcher at his house for a pre-course get-together December 9th. It's going to be a blast. What a better way to enjoy winter by being in Madeira Beach, Florida, and earning up to 16 CEU hours. Sign up now at appliedneuroscience.com/attend-ng-workshops. Mindmedia.com. Get the latest EEG and neurofeedback technology from mindmedia.com. Their semi-dry sensor cap is a wonder to see, and their EEG amplifiers have been trusted in the field for decades. Their neurofeedback and qeeg courses will get you up to speed in no time. Visit mindmedia.com now.